people and provides a number of programs, services, and supports to youth experiencing homelessness. This is an issue I care deeply about. It's complicated, it requires time to develop and implement solutions, and there is no one-size-fits-all. It can be a very polarizing issue as well, making it even more difficult to talk about. But it's one that we can and must work together to address. So I want to thank you for joining us today. We're fortunate to have an outstanding keynote speaker, Nan Roman, joining us from Washington, D.C., as well as a panel of recognized local community leaders who are working on this issue. But before we get started, I wanted to go over a few housekeeping items. First, I know we have some sync issues. I apologize. These are connectivity issues that I'm experiencing, so I apologize in advance. This is being live streamed on Facebook and YouTube, and a recording will be available for watching later. We do not have the ability to take questions from the virtual audience, but anyone wishing to provide comment or ask a question may do so by emailing rethinkhousing@everettwa.gov. And as I mentioned, this event is part of a series of forums and community conversations that we're putting together as part of our Rethink Housing initiative. Our next community chat will be next week on February 18th, and the topic for that conversation will be housing near transit areas. The chat sessions are more interactive and a great opportunity to talk about transit needs and ideas, and you can find more details on that at our website. So before we hear from our keynote and panel, I wanted to take a minute to set the stage regarding the current homelessness situation here in Everett and highlight some of the work we're doing locally. According to the last point in time count, which was conducted in January 2020, there were roughly 1,100 unsheltered people countywide, and that's 642 right here in Everett. The shelter capacity throughout Snohomish County is around 446 beds, with another 200 cold weather shelter beds. The shelter capacity in Everett is about 348 beds. However, due to COVID, that capacity has been significantly reduced. For Everett, that means we have roughly 100 fewer beds than usual. And many of our shelters are population specific. Some serve only youth, some serve women, and so that can further limit the number of options and beds available to those seeking shelter. So clearly the supply of shelter beds is insufficient to address the needs that we have in our community, and the need is great. So I wanted to talk a little bit about what we're doing locally to address the need. First, as I started, there's no one-size-fits-all option. Many different factors can lead to an individual becoming homelessness. Therefore, we need an array of support and services to help people get back on their feet. During my time at Cocoon House, I witnessed a variety of trauma and circumstances that can cause youth to be without a home. Many kids had been victims of abuse, had suffered from addiction, or had significant mental or behavioral health issues, either personally or at home, that caused the family to break down. I saw how much it takes to turn lives around, and I also saw the resiliency of some of the kids, which was really inspiring. I also saw how resources, support, and compassion can truly bring the necessary stability and hope for a better future and build that resiliency in youth to help them turn their young lives around. So as we look to the broader group of individuals and families who are unhoused in our community, clearly more resources are necessary, coupled with effective, compassionate, and innovative solutions. This includes shelter and affordable housing, which provides stability and safety. It includes access to services and treatment, medical and mental health care, financial assistance. It also includes putting in place systems that help people stay housed. And I know Nan and our panelists will talk more about some of these strategies in just a few moments. But to highlight a few things that we're doing in Everett, you know, I get this question a lot, like, why don't we just build more shelters? As a city, we don't have the capacity, the resources, or the expertise to build and manage all the shelters or establish and run all the necessary social support programs to help the community members in need. But we can work closely with partner organizations who are our experts in providing the services that help bring those experiencing trauma and experiencing homelessness better outcomes. This includes our partners at Everett Gospel Mission, Catholic Community Services, Cocoon House, Housing Hope, the YWCA, Salvation Army, Interfaith, and so many other amazing faith-based and nonprofit organizations here locally. To help those struggling this past year in the pandemic, in Everett, we worked in partnership with Snohomish County and administered $800,000 in CARES Act funding just here in Everett for rental assistance and housing stability. As a city, we're in a unique position to bring partners together. So one of the things we're doing is we kicked off our homeless student task force, co-led by Joe Alonzo, who's here with us today with Cocoon House, and Dr. Joyce Stewart, who's a former educator. They're working together with committed, experienced, and creative task force members, and they'll be meeting over the next few months to provide recommendations on how we can achieve better outcomes for homeless students in the city. We're also working on a pilot project for temporary shelter using small pallet shelters. We look forward to working with the Everett-based company called Pallet to procure these low-cost, easy-to-assemble shelters. One thing I really like about this company is that they hire and invest in people who themselves have experienced homelessness, addiction, or incarceration. And we'll be briefing our council next week on this project and hopefully moving that forward again with partners and support, especially Snohomish County Human Services. And we're currently in the process of adding more social workers to our community outreach team. This team works together with our police department, and as they're called out to deal with some of the street level social issues, our embedded social workers work with the police to respond to those issues and help community members who are struggling, connecting them to services. So although we have all this good work underway, we know there's more we can do, and we need more innovative solutions. So again, thank you for joining us as we discuss this in more detail. With that, I am very honored and happy to introduce our guest speaker. I had the opportunity to meet and work with Nan Roman at the National Alliance to End Homelessness years ago when I was part of Cocoon House. Nan is president and CEO of the National Alliance to End Homelessness. She's a leading national voice on the issues of homelessness. She's passionate, creative, and realistic when it comes to these issues. Under her guidance, the Alliance has successfully identified and promoted innovative strategies for ending homelessness that have been adopted by communities across the country. In her role, Nan works closely with members of Congress and the administration, as well as officials and advocates in state and local government. And she collaborates with partners to educate the public about the real nature of homelessness and effective solutions. Her perspective comes from more than 20 years of local and national experience in these areas of poverty and working with community-based organizations. So Nan, thank you so much for joining us today. It's such an honor to have you here.
Thanks so much, Mayor Franklin. It's an honor to be with you. I have indeed had the pleasure of working with the mayor when she was running a homeless program there, but also as mayor over the past couple of years on housing and homelessness issues, and very much appreciate her leadership and skill. We are, of course, at a very challenging moment in the nation with regard to homelessness. We have the COVID-19 pandemic. We're all trying to keep people safe in what we know are not the safest environments, congregate shelters and outdoor encampments and sleeping. The programs are all worried about their staffs and the safety of their staffs. And even though now there is a vaccine, there are many challenges around getting that vaccine to staffs and to people experiencing homelessness. We had a recession and we're facing the result of that. Widespread unemployment has continued, and lower wage workers are by far the most impacted by that recession. And there's been the social unrest and political division in our nation. That's an added challenge. Another huge challenge for us is that all of these issues disproportionately affect people of color. We know that nationally, people of color are more likely to get COVID, more likely to be hospitalized, and more likely to die than white people. Nationally, people of color are more likely to be unemployed and more likely to be arrested and killed by police than white people. And homelessness also disproportionately affects people of color. Don't quote me because I'm not always the best at math, but it looked to me like people of color are about 25% more likely than white people to be homeless in the county, in your county. So we really have a trifecta of serious challenges that are disproportionately affecting people of color, and homelessness is getting added into that mix. So there's a lot to overcome at the moment. Where exactly does the nation stand on homelessness at the moment, and what are the trends that we're seeing? It's not entirely clear where we stand on the homeless numbers because there's not really been very much data coming in since the pandemic began, but there are some indicators. The Alliance has surveyed the nation's continuums of care homeless systems 3 times since March. And a few things that we have heard I think are interesting. A third of COC's continuums of care have added shelters or shelter beds, but a third have reduced shelter beds. Half of the continuums are experiencing staffing shortages, primarily in frontline workers. About 80% say that more people are asking for help than prior to the pandemic. 2/3 of the people we surveyed believe that unsheltered homelessness is going up, and 90% say that they believe there are likely to be further increases in unsheltered homelessness. With respect to race equity, 2/3 of the programs say that they are designing more equitable housing outcomes, but only less than a third say that they are doing anything to improve equity with regard to testing, street outreach, isolation and quarantine of people, or services. And a third said that they are taking no specific steps to improve racial equity. Putting aside the pandemic for a moment, in 2007, there were an estimated 650,000 people homeless every night in the country. From 2007 to 2016, the number shrank to 550,000, so 650 down to 550,000, as we focused the homeless assistance more on housing. However, since 2016, the number has gone up slightly every year, and we're now up to about 570,000 people. Within these trends, there are some subpopulations of homeless people who have done better than other subpopulations. Veteran homelessness has been cut in half since 2007 by using a housing first approach. I'll talk about that a little bit in a minute. And also because of a significantly increased resources to help homeless veterans from Congress. Families have also been relatively successful, with decreases of about a third since 2007 nationally. And that appears to be continuing during the pandemic, which is interesting, might be something to discuss later if that's happening there. Where things have been less successful is for individual adults and unsheltered people. They have gone down, but they haven't gone down nearly as much, and we don't have as clear strategies for those groups. Youth, we don't have good data going back that far on, so it's hard to tell. So while homelessness is still lower now than it was in 2007, it has been creeping up since 2016, and it is very likely that the pandemic, the recession, and the divisions in the nation have and will continue to push the numbers up. So we have challenges in front of us, that's for certain. But even in the midst of these challenges, there's some significant opportunities. What should we be doing to start to drive homelessness back down? What should our values be? Where does practice need to go? And where does policy need to go? First, in terms of values, we think that we need to make an across-the-board commitment to ensure that everything we do addresses racial disparities. We know that these disparities drive a lot of homelessness, and we won't end homelessness without addressing them. Another important value is to help people with the highest needs first. We're often tempted to help lower need people first because it feels like, well, we could help a lot more people that way because it costs less per person or per family, and we can move them out of homelessness faster. However, the lower need group is much more likely to exit homelessness on its own without any particular assistance, and failing to help the highest need people tends to result in increasing, not decreasing, the number of people who are homeless because they stay in the system longer, and I'm going to get to that in a minute too. Focusing on high need people is also a really critical race equity strategy because people with more serious problems are much more likely to be people of color due to systemic and historical discrimination in areas like healthcare and housing. So that's also an important value. A third important value is to maintain the goal of housing people. It's definitely true that housing them is not the only thing they need, and it doesn't solve all of their problems, but it will end their homelessness by definition. And so that really does need to be the goal. The solution is not just getting everybody into shelter, it really is getting everybody into housing. And a final value is the need to act much more quickly and with urgency in assisting homeless people. We showed that we could act quickly when the pandemic hit, and we compressed shelter. We moved people into hotels and motels. I don't know if all these things had happened in Snohomish, but I would guess they have. People quarantined and isolated. We partnered with FEMA and healthcare providers. We did in weeks what normally would take us months or even years to do. It's difficult to maintain a sense of urgency for years on end, and that's how long we've all been fighting homelessness. But homelessness is an urgent problem for every single person who becomes homeless. It's not the status quo. And nationally, the length of time that people spend homeless is going up, and it needs to be going down, way down. So these are some of the values that we think can overlay our efforts to end homelessness. What practices can be adopted to reduce the numbers? I should start by saying that much of what is already being done is working. The issue is really less about what to do and more about how to have more resources to do more of what we're doing. It's not that homelessness is going up because everything the homeless providers and the systems are doing isn't working at all. Having said that, there are things that work better than other things, and there are emerging practices that show promise, and there are some things that are more cost effective. And because we don't have enough resources, being cost effective is really important. Housing First is one strategy that seems to work very well. Housing First is really just based on the idea that people can address their challenges better and faster if they get into their own home, the faster they get into their own place to live. It's not necessarily the right thing for every single person. As you said, Mayor, there's not a one-size-fits-all strategy, but generally services first and then housing doesn't work as well as housing first and then services. That's basically it. The best example of success in that area is the work on veterans. The VA adopted Housing First and shifted most of its resources, and there were also more resources, to moving veterans much more quickly into housing. And as a result, veteran homelessness was reduced by more than half. The state of Virginia adopted Housing First, required all of its homeless grantees, which in this case were smaller communities and rural communities, smaller cities. They required all their homeless grantees to adopt Housing First for families, and they cut family homelessness nearly in half in a couple of years. Diversion is another important emerging practice. It's defined as catching someone just as they become homeless, so they've lost their housing, but before they enter shelter or go to sleep on the street. It tries to find a quick alternative to shelter, like helping people return to the place. Oftentimes people become homeless because something's happened, with the people they're living with, and there's an argument and they become homeless and they go to enter shelter. Sometimes you can mediate that or provide resources or something that will get them quickly back into that housing. Sometimes they need some deposits to move someplace else. It's generally very cost effective. It does not work in every case, but it can cut the inflow into shelter significantly. Connecticut does diversion in a state with a high percentage of people requesting shelter. A high percentage of them are diverted, and very small percentage end up ever entering shelter after they've been diverted. So it appears to be a successful strategy for them as well. If people do have to enter shelter, low barrier, housing focused shelter seems to work best to end homelessness. Many people are unsheltered because of shelter policy. It's not because they don't want shelter per se. They do, but shelter is not a good prospect for them. Shelter is often, I don't know what it's like there, here in the District of Columbia where I live, shelter for individuals is all on a night-to-night basis. You get it one night, you're not guaranteed it the next night. That's often the case. They have a lot of rules in most shelters. Often shelters can't or won't let people bring in their possessions, their pets, their partners. So for many people who are unsheltered, it's really not a rational decision for them to give up their tents and their cooking equipment and their dog for a night in shelter with little or no guarantee that they might have another night. If they do enter shelter, there often are a lot of rules and sanctioning, and little or no path to the thing that they really want, which is usually housing. So people are more likely to go into and to benefit from shelter that is low barrier, supportive, and has a path to housing. Again, it doesn't have, there can be alternatives to that. It's not a one size fits all, but generally speaking, we have less of that low barrier housing focused shelter than more rigorous shelter. Increasingly, there is consensus that congregate shelter is also not the best model. It's traumatic. It can be traumatic. It obviously has health considerations around it. We've learned during the pandemic. There is certainly a balancing act, however, with respect to how much you would want to spend on making all shelter non-congregate versus using that money to get people into housing. Obviously, as you said, some people also need services, not all, but many, and all services should be delivered in a trauma-informed manner. The services work better if they're delivered to somebody once they're in housing, but they can and certainly should begin in shelter if they're needed then. Critical time intervention is an evidence-based short-term model of helping people who are moving into housing to link to services in the community. CTI has been widely adopted, again in Connecticut, to very good effect as people transition out of shelter. It was actually originally developed for people exiting psychiatric hospitals for the community. Looking more broadly at the homelessness systems, communities should be using their data to make decisions about what to do. Are the grantees that receive the federal funding and other funding delivering the outcomes they should be delivering? Whose needs are the greatest and what's the most effective in helping them? Are there racial disparities in your system in terms of who gets in, how long they stay, how many people exit to housing, and how many return to homelessness? Those are some of the things that data can be used to determine. There's a coordinated entry should also be using data to determine who has the greatest needs and to focus on getting those folks into housing, while also providing a lighter touch assistance to those who likely can get into housing on their own. With respect to unsheltered people, there really is very little data on what works best. Basically, they need to be brought indoors as soon as possible because of the horrific health consequences of being unsheltered. Reducing shelter barriers is a really important element around unsheltered people, as I said. Non-congregate shelter also seems to be working really well for them. The isolation and quarantine, use of hotel and motel rooms for isolation and quarantine of unsheltered people has been extremely successful around the country. The changes in the FEMA eligibility, in which FEMA is agreed now to reimburse 100% of the cost of hotels and motels, not just for isolation and quarantine of people who are homeless, could help with this. As definitely could the pallet shelters that the mayor mentioned that you're planning to stand up. I think it's going to be fascinating to see the data on those, and that's kind of another way potentially to provide cost-effective non-congregate shelter. I would also note, I don't know if you're familiar with the Boise decision that had to do with ticketing and citing people for sleeping on the street, but the Boise decision was on encampments and sleeping on the street was settled this week, and it establishes that it is illegal to cite or arrest people for sleeping outdoors unless there is a shelter bed that's available to them. So that's going to have an impact on unsheltered homelessness as well, I think, a positive one. A key feature of the race and equity discussion around homelessness has been the importance of engaging people with lived experience of homelessness in all elements of program planning and implementation. It's also important to ensure a full range of culturally specific programming and to ensure that staff has cultural competency. So those are some other things to be looking at. Quickly, several things that you could be thinking about as we move forward, or we certainly are. One is the rapidly increasing age of the homeless population. The aged homeless population, homeless people are aged at age 55. They age much faster. The aged homeless population will double by 2025 and triple by 2030. And the homelessness system is not equipped to handle the health needs of this group. According to researchers, the cost of housing for elderly people who are homeless 55 and older would easily be offset by the savings to the healthcare system if they were housed. So that's something to think about working with your partners on. Another issue is the currently large demographic cohort of young adults. Modern homelessness arose in the 1980s, largely because of the loss of affordable housing, but also a factor was that there was a large cohort of young adults at that time that, because of back-to-back recessions, was unable to attach to the job market. This was the largest cohort of the homeless population then, and it still remains today the largest cohort of the homeless population, that age group. We have the same issue now, albeit with a slightly smaller young cohort, but with the addition of all the schooling challenges that young people are facing. And if we don't seriously and deliberately address getting these young people attached to the job market, we risk a whole new wave of homelessness over the next 30 years, destroying all the work that we've done to try to solve this problem. Finally, the pandemic has placed homelessness firmly within a public health context. This understanding could help us to create formal resourced partnerships with key health entities and to link that with housing. And we should probably be thinking about the same thing with regard to employment, for the reason I said, not just young people, but all age groups and populations are going to have trouble attaching to the job market because of the recession we've just gone through. Quickly, some things that we believe need to be fixed in the homelessness system. We need a new verified assessment tool, and we need to move on to the new generation of coordinated entry. We should stop using homelessness funds for eviction prevention. Eviction prevention doesn't prevent very much homelessness at all. Very small number of people who are evicted become homeless. Very few people who are homeless were leaseholders. We should encourage and require federally subsidized housing like tax credit properties to accept homeless tenants and formerly homeless people as tenants. Some things I think we should try: cash transfers. There's some evidence from Europe and Canada that cash transfers would be cheaper than the homelessness system in solving the problem. That's not going to work for everybody either, but it's worth experimenting with. We need a real plan for ending unsheltered homelessness. We're really getting nowhere on that. We could create formal resource public partnerships between housing and employment public sector agencies and housing and services agencies. And we could address the flow into homelessness by holding the feeder systems more accountable for housing. Feeder systems into homelessness like jails and prisons, health and behavioral health facilities, and foster care. In closing, I know that budgets are tight at the state and local levels, but there is a lot of federal funding on the table already. And if we at organizations like the Alliance and our partners do our jobs, there will be considerably more public resources coming, including vouchers, housing acquisition funds, and homeless assistance. As I said at the outset, the solution to homelessness is not, notwithstanding what the mayor said, in another way, it's not that complicated, because people who have a home are not homeless. That doesn't mean that people's needs are not complicated. They are complicated, and they need more than that. But if they have a place to live, they're not homeless. What's complicated is providing that when you don't have the resources to do it and getting people hooked up to those services. That is the challenge. Thank you so much to all of the panel and to the mayor for all you're doing in Everett to end homelessness. And thank you especially to the mayor for her local and national leadership. And I look forward to the discussion with other panelists.
Thanks so much, Nan. Wow, that was very insightful. A lot of great information you shared. And I think you really brought across the urgency of this issue. As you said, I think it's hard to hold that urgency because we've been working on this so long, but as the need is continuing to rise, the pandemic has layered additional challenges. We're still dealing with the disproportionality. I think that's really important. And then I really loved the values that you brought in that we need to keep in mind as we work on this issue, thinking about addressing the disproportionality, addressing the highest needs, housing itself, it needs to be a first and foremost, and keeping that sense of urgency as we look for more resources. So I'd like to invite the rest of our panel to join and continue the conversation. As I shared, our panel includes local leaders who work every day to find these compassionate solutions to solve homelessness in our community. I'm really pleased to invite Mary Jane Vujovic from Snohomish County Human Services. She's the director there of the Human Services Department, Joe Alonzo, the CEO of Cocoon House, and John Hull, the director of strategic initiatives with the Everett Gospel Mission. These leaders are honestly some of the most dedicated, compassionate, and innovative leaders in the country on working on these issues, and I feel just incredibly proud to have them here locally as we discuss these challenges and innovative solutions. So thanks for being here today. To kick off our questions, I thought it would be good to hear from all of you panelists, kind of get a little bit of a taste of your firsthand knowledge of the challenges of moving individuals off the streets and into permanent housing. And so I'm hoping that you each could share a story of a client or describe the work that you do that highlights the complexity of the issue and what it takes to successfully house individuals in our community. And so, I'll open it up to whoever would like to go first with that question, and then I'll probably start calling on you directly. John, I hear your laughter, so you're it.
I'm it. Well, thank you, and thank you for hosting this discussion. I'm being told my camera's not on.
We can see you.
We're seeing you.
My camera's on. Okay, good. Sorry. Thank you. Thank you so much. And thank you for your beginning words. It's just encouraging and such a wonderful thing to have such an advocate for what we do as our mayor in this city. And thank you for your leadership on that, Mayor Franklin. As I was thinking about this question of the complexities, I think you said it well, that there is no one solution. And really, I think as each person walks through our doors, that's a different person that needs a different and unique solution for each person that comes into our shelter. That doesn't mean that there's not common challenges that we face. I'm still stuck with probably the biggest challenge we face is simply housing. That no matter what we do, and I've said it, and we work with a lot of churches in our community, that we could have the most successful programming that helps people deal with all of the non-housing related issues that are contributing to their homelessness, and still not have a house to put many of them into, because there's just simply not enough. And as Nan was talking about, highest needs and lowest needs, we have definitely seen that middle category of individuals. They're lost in the middle. That their needs aren't high enough to get into immediate housing. They're not necessarily able to get out on their own. They need some sort of subsidized opportunity, or frankly, just an affordable opportunity. So, we've been reflecting a lot on a target of how do we build housing that's sustainable for $500 a month. And that may not be the right amount, but it's an amount to begin with. And just that discussion of, is it even possible to create solutions like that for those individual adults in their 45 and 55 and 65 that are living on $800 and $900 a month to be able to afford to live? So that's probably our biggest challenge we're faced with. I mean, there's so many other things in terms of relational connection and making those relationships happen. But when I look at the large scale from our perspective as a congregate shelter right now, that's the biggest barrier we face.
Yeah, thanks, John. Joe, do you have a story or kind of that highlights kind of the challenges that you see in working with youth in this issue?
Yeah, and thank you, Mayor Franklin and Nan, for your remarks. They both resonate so much with me, and the complexity is everywhere. And youth homelessness has all of those same complexities. What came to my mind is the added complexity of youth housing systems and young adult housing systems, and they don't always align super well. And I think about the complexity of youth having experienced a lot of trauma, having had multiple people come in and out of their lives and the setbacks that they've faced, and then trying to navigate these two totally different systems within, the week that they turn 18. We have one young person that comes to mind that was living in our under 18 long-term transitional housing program, 24/7 staff, a lot of support. Took a long time to really stabilize that young person, get him engaged with the mental health system that we had. address chemical dependency needs, and ultimately you age out and you don't get to stay in that environment. And so we moved this young person into a Cocoon House sponsored over 18 program, but the service model is very, very different. And so now we're facing a young person who kind of lost that service support network, but also has to face the new unfamiliarity of isolation in a studio apartment by themselves. And what we've experienced is then what happens with the community that surrounds young people. Obviously, young people want acceptance, they're vulnerable, and we see folks that we wouldn't naturally pick for them become their support network and the people that they associate with. And we've had a lot of struggle there. So this one young person lost their job not long after becoming independent on their own in their permanent housing unit, began sort of hanging around folks that weren't all that healthy for him, and ultimately started suffering from some mental health concerns. So the housing is important, but I've heard it from all of you now, the need for services is paramount. And so in addition to the housing, case management, mental health support, chemical addiction services, healthcare. And I want to also emphasize the need for peer mentoring, peer support. And I think, Nan, you mentioned that as well, lived experience. In this young person's case, I think it was our peer mentoring that really turned that young person. And so we're really, I think, countywide and within Cocoon House, looking at ways to incorporate much more intentional youth voice into the programs and services that we offer. And so, yeah, that's kind of one added element that I just want to make sure we illustrate today as a need.
Thank you. I think what we're hearing pretty clearly is how complicated it is, and that it really needs to be tailored to each individual's needs, what has brought them to this point in their life, and what will help them stabilize and recover. I think I'll direct the next question to MJ first and see, this is a really polarizing topic. I think there's a lot of people in our community that feel like we're not doing enough to address the situation, that people should be responsible for some people, then others think that people should be responsible for themselves, and these programs don't work. I know as mayor, I hear from both of these groups, and people are frustrated with what they see on the streets, but they don't want to see new shelters or new housing programs going up in their or any other neighborhood. So MJ, maybe we could start with you. What are some of the successful ways that you've seen you or the county or organizations engage with the community to address their concerns so that we can bring more solutions forward?
Well, it's a really interesting question, Mayor Franklin. Again, thank you so much for this opportunity, and Nan, thank you so much for your thoughtful remarks. I'm always impressed by the historical perspective that you bring to this work and the depth of knowledge. In terms of engaging with the community, and I'm not going to say it's being done perfectly at all points in time. I think one of the key things that the elected officials who've come together through the Housing Affordability Regional Task Force have said is we really haven't figured out how to bridge the gaps between all these communities. And what we really need to do is develop a high quality communication plan. I think some of the key factors are really getting people of goodwill who are willing to all work together in a room and saying, what are those different perspectives? How can we lay those on the table, and what can we do to address those concerns? If we're not actually hearing all the concerns, we're sort of taking a stab at how do we respond to them. There is a conundrum of government, if you will. It's like when we do get enough resource to address an issue, people don't see it, so they don't think it exists. And then when it balloons, or, so you stop investing in it and then it balloons. And now we've got, well, government doesn't know what they're doing, or we wouldn't have the issue to begin with. So I think letting folks know what is being done and what is successful to whatever scale it is, because so many of the issues that we face, and I think Nan was really right on point with saying we know a lot about what works. It's a matter of scale and how do we act with urgency, both in terms of scaling our responses and being able to increase investment in an area and decrease investment as we need to, or reinvest elsewhere. So I don't think that we need to disinvest in the common good. So I think, first of all, getting people of goodwill together, getting all those perspectives on the table, coming up with a common plan that we all can speak to, really getting our talking points and going out there and reaching out to our constituent groups, because you know what, you change opinions one person at a time on a lot of this work. And so it's got to be, just as the problems of what cause homelessness or individuals, how people's perspectives are highly individual as well. But to the extent that we are out there talking, that we are really speaking to those same points, to the same issues, and we're doing it in concert rather than at cross purposes. And for all of us, that means sometimes putting aside whatever our own view is for the common good view that we created in that shared space that we worked in.
Thanks, MJ. I'd love to hear from all of you on this issue. Really, I think so much of what I hear is, as we work on some of these solutions, is if we build it, they will come, and that is the fear I think that exists. As people see the rising need, I think, Nan, you articulated well. It's not that what we're doing isn't working. We just need more resources to do it. But I think there's this community fear that by adding more resources, more capacity, more shelter, more housing, we're gonna increase the problem. So how have you, Nan and Joe John, kind of dealt with that as you're working with communities and adding capacity to our systems?
I can start. I'll just say this is something we hear in pretty much every community I've visited, that if we do anything, people are just going to swarm there because of the fantastic services being provided. There just is not evidence that is the case. And any place that you look, the data tells the story, and any place you look at the data, it essentially says that the homeless population looks exactly the same as the jurisdiction's population in terms of how many people are local and how many people somewhere else. I will say that in larger cities, I don't know there, it is sometimes the case that the suburban communities don't have as many services, and then people in the area do get pushed into the city to get assistance. But as for people coming elsewhere, no, I don't think I don't see it happening from data. I just don't think it happening.
I'll speak and just say I think education. Can you hear me? I think education plays a huge role. I think there's so many stigmas and stereotypes around homelessness that being able to use, as Nan said, data to educate folks it's repetitive, but it's crucial. We know homelessness is everywhere. We know it looks different in different communities. It exists in wealthy communities. It exists in poor communities. And it does have an impact on public health and community well-being in any community. So my view is, if we're going to be serious about addressing homelessness, then we have to have interventions and strategies that address the entire homeless continuum. So robust prevention strategies. I'm speaking prevention all over the place. Wouldn't that be great? We can't ignore prevention, but we also have to have those intermediary interventions, and we have to have the programs that really bring people in off the street out of chronic homelessness and provide them with dignity and care that they need and deserve. So I think it's irresponsible for a community to ignore any area of the continuum, because that's how we're going to get out of this mess, is interventions at all levels. So I would just want to continue to sing that song and loudly and to whoever would listen.
Well, at the risk of, go ahead, Nan.
I would just add one other thing. Go ahead, and I'll please go ahead.
At the risk of sounding crass, because I don't like the phrase they, because they're individuals and they're not all the same. But they're already here, and we haven't built any new shelter in years. And we haven't necessarily increased our services in our community in years, as far as shelter services go. So I think that's ignoring the evidence that's right in front of us, that we haven't built it, and yet we are seeing the numbers go up. So that's probably the first thing I would say. I would think that the other thing we're learning is that we have to have a continuum of care, like Joe was saying, and that continuum needs to include many solutions, not just congregate shelter. And Nan, I am now, I'm going to say my new mission in life is to redeem congregate housing. And undo the fear that it's unsafe and it is uncaring, and that I'm proud to say in our community that almost all the shelters, I think all the shelters are 24/7 shelters that provide stable housing with services. And so we've been doing that for a long time in our community, and we haven't necessarily changed that. So the reality is the folks are here. And we need to provide solutions that meet their needs. And so for some, that's non-congregate shelter options like pallet shelters. And for others, that's increased congregate shelter options. When I talk about that middle group, congregate shelter often works really well for that middle group. It's stable. It provides peace and security from which they can make decisions to help pursue their homeless recovery. So I think that's an important part of the overall continuum.
Oh, yeah, I agree. I mean, it's been said 20 times already. There's not one size fits all. And plenty of people that get into hotel and motel rooms feel isolated and unhappy.
Well.
So, you know, the only other thing I was going to say, though, about the community, is maybe not such a positive message, which is there's always going to be pushback. And no matter how brilliant your argument or groups that you utilize to support putting up new facilities, affordable housing and shelters and so forth, there's very often the people who especially live the closest to it are going to oppose it. And just especially for public leaders such as yourselves, it takes also what you see around the country is it takes a real backbone to make these things happen. And there are people you're not going to persuade, you know that, and that are going to be nasty and, give out your phone number. I mean, it takes really strong public leadership to make good things happen in the community too. And you can't pretend it doesn't, and you're just going to convince everyone, because you're not going to convince everyone. Maybe sometimes, but not all the time.
Thank you. That it is true. It does take. We're fortunate here locally to have a really collaborative community, a community-minded community, I guess is the way I see Everett and Snohomish County, and willing to try and innovate to address this issue. So it's I feel fortunate to live and lead where we do. I think this kind of brings us to the next question is. This isn't a challenge that any one city or any one organization can tackle on its own. Our organizations have worked together for years, and I really appreciate the partnership and collaboration that we have here, through the providers. So I'd love to have the panelists speak to some of the benefits and successes of the regional collaboration and cooperation that you've experienced. Or if you have any specific success stories that you want to share of the synergies that come from that collaboration. And Nan, I'd love to hear successful models from you as well. So I'll kick off that question with MJ. You gotta unmute yourself there, MJ. Thank you.
I keep doing that. We've seen successful collaborations all over Snohomish County and in communities throughout the county. And, it is true that the proximity of services in the cities does make for an environment in which people are accessing more services. But we see people living and staying in the communities where they have connections all over this county. And, really excellent collaborations. I'll give one from East County and then one quickly from Everett. In East County, it's been a real challenge, particularly these last few winters where we've had very long cold periods, to come up with what was a cold weather sheltering system that was largely reliant on volunteers and local buildings, really, the buildings really not being able to handle that, the volunteers working alone not being able to handle that. This winter, we're addressing that in Monroe by having opened up a facility on the fairgrounds being operated by a nonprofit agency with a number of nonprofit and the local city partner as well as county partners. It's been very helpful in that it is very close to the isolation and quarantine site out there. So we're able to move people very quickly from shelter into quarantine if that's in isolation, if that's necessary. And that's really been standing that up. I think it was like a day or two before, I think it was Halloween, that suddenly there was a cold snap and the community coming together stood that up literally in a day. So that was an amazing effort. I think here in downtown Everett, as we have had to, John has faced this, Joe, we at the county at our facility have had to move people into hotels and motels, but we've also had to maintain congregate sheltering and try to figure out how to do that quickly. And people have been moving around within the downtown area quite a bit as locations have moved around. We've come together as shelter providers and funders of shelter provision, and Everett Police Department, Snohomish County Sheriff's Office, our facilities folks, local churches, all coming together to identify on a regular and ongoing basis the Downtown Everett Association. Where are we seeing issues that are surfacing downtown because people can't go and have access to normal sanitation facilities and the like? Where are we seeing issues? We collectively go, what are we going to do? It's on a day by day. What is the issue that we have to solve today? And we're working together on that and really taking what was becoming a very challenging situation, which is still challenging, but it is having less of an impact and we're helping solve issues much more quickly. So those partnerships, those collaborations have been absolutely critical to addressing that need.
Thank you. Joe or John?
I can jump in. I think collaboration is one of the strengths of this community. Snohomish County as a whole, and Everett is definitely no exception. And I think one of the benefits that we see through strong collaboration is good communication quickly. And so it gives, different perspectives, different optics on an issue where more, different systems, different folks can come together and address it from their perspective. One example we have is the youth homelessness demonstration projects that obviously came through HUD in Snohomish County. We have it's called a Permanency Navigator Team program. We call it the YET team in-house at Cocoon House, but it's really utilizing our internal staff, case managing youth across systems. So we're working with juvenile justice, we're working with child welfare, behavioral health providers, schools, all to kind of talk, like basically case staff what's going on with the young person before they really pop onto our radar. We start picking up on trends and then provide that case management with them wherever they go. And we, even if they get stable housing, we're able to collaborate and continue services to that youth for a period of time. And so models like that allow us to address the need quickly and effectively. And I just think that collaborative spirit is something that we need to continue to promote within our area.
So I can highlight a couple programs. One would be our partnership with Providence Hospital and a respite care center for individuals in the hospital that are experiencing homelessness and can't be discharged onto the streets and still need care. That we have now an extended acute care respite center for those individuals, and we have eight beds that Providence uses, and they're full on a regular basis these days, which is really good. It took us a little while to get up to speed, but we're glad that we're able to take care of that. And again, that's that just partnership, understanding the needs in the community, knowing the other leaders in our community, and just talking through what do we need and how can we be that solution. We had to go back and look at our facility and say, well, if we put some water in over here and we change this here, and so we remodeled our facility a little bit to make that happen. But it worked out great for all of our guests at the shelter because they got a new dorm space. And then another partnership we have is with the Marysville right now, the city of Marysville. We call it the MESH program, or Micro Emergency Shelter Housing. And this is homes that the city of Marysville owns that they intend at some point to probably tear down. And they're part of future development plans, but they're currently not being utilized and don't need them. And they had the choice of renting them or working with an agency to house individuals. So we implemented that program, and we have 6 people in those 2 houses right now. Our most recent one is actually with the embedded social workers that they refer individuals into it, and it's worked out really well. I think the overall partnerships of our agencies and the embedded social workers has been strategically for our communities a huge win for all of us. One of the things I realized about Snohomish County is it's really large geographically without a massive major center. I mean, Everett is 100,000. There's 800,000 people in the county. And so there are pockets of poverty and homelessness all around our county. And the idea of doing outreach for one agency is difficult and challenging. Having I've looked at other shelters, they got outreach vans, and it's like, well, in an hour they can hit like 10 encampments. That might take us 5 hours to do in Snohomish County, and so it's not all that reasonable. But having those social workers with the officers and then developing those relationships that we can really provide support to those embedded social workers has just been fantastic, and I think such a critical thing. And I'm glad to hear it's expanding.
Thank you. And, I know my team is going to actually be giving me the, let's wrap up here. So I've got to target a last question here, but I do want, Nan, I guess I'll ask this of you just real quickly, what can we do to bring, as a community, what can our individual community members or we as community leaders do to advocate for more resources at a state and federal level? Because that's clearly, this $2.3 million demonstration grant, we need more of those coming into Snohomish County to tackle these issues we have. So what can or should we be doing? You have to unmute real quick.
I was going to say I don't live in a state, so I don't know what you should say. But at the national level, I mean, when we go to the Hill to talk to members of Congress or their staffs about what your needs are and everybody else's needs, we have, great relationships and they listen to us, but really who they want to hear from is not us, it's you. And, everybody who cares about these issues should have personal relationships. It's not really lobbying 99% of the time. It really is them trusting you as advisors and people that can tell them what's needed and what's needed in your state and jurisdiction. I'm sure this is the same at the state level. And really, delivering calls and so forth when we're at key points, which we are going to be at a key point coming up now. It's regard to this stimulus, and there's a lot of money on the table in this stimulus bill for homeless assistance. There's $5 billion specifically for homelessness, and if we get our way, there are going to be a really huge amount of single-use vouchers, not regular vouchers, but still a big load of vouchers, and a lot of other things through the services side as well. So I think it's basically just getting to know your delegations in Congress and making sure that they are coming to you to get advice about what to do about these issues. Because if you tell them what I've heard here today, they're going to do the right thing.
Thank you. Thank you so much. I think, we just had enough time to start this conversation today and really get our community minds thinking about the challenges that we're experiencing, and also the innovative programs that we are trying to do here locally. We got some great ideas from Nan, and as always, I leave these types of conversations just feeling grateful for the leadership that we have in this community and the dedicated servants to our individuals and families experiencing homelessness, and the leaders that we have in our local organizations. So thank you. Thank you, Nan, for joining us, and thank you to MJ, John, and Joe for taking time. Just really appreciated the conversation. As this is the beginning of our work as a region, we'll continue working with you and our other important partners on solutions to find stability and support. So for all of you watching, I hope you'll join us for future events. Over the next few months, we're going to be engaging with the community on housing issues and help inform the development of our housing action plan, which we expect to present to our city council this fall. And so that will include the virtual chat sessions that I mentioned earlier, and March chat session will be coming up. So hopefully you'll pay attention and join us for those. The topic in March is going to be on building housing, and we plan to have speakers from housing developers and providers. So really encourage you all to stay engaged. Please visit our website at everettwa.gov, Rethink Housing. And you're also welcome to share your comments and ideas by emailing rethinkhousing@everettwa.gov or contacting Becky McCreary, who's in charge of this project. So thank you again to all of our fabulous panelists. I appreciate your time, and thank you to all of our virtual listeners for tuning in. We look forward to continuing the conversation.